The most common hernias that we see in surgical clinics are inguinal hernias, which usually presents with discomfort and a bulge in the groin. And this can affect two different patient groups, really. Your sort of young, sporting people, more commonly in males than females, an inguinal hernia. So footballers, weightlifters, keen gym attenders would tend to get an inguinal hernia. And also in the 70 plus bracket, they would also get inguinal hernias. The mechanism of the defect is slightly different in those two cases, but they both are treated with the same operation. In females, it'd be more common to have a femoral hernia, which is slightly lower in the groin, because females have a wider opening next to the femoral vein, which is the major vein that drains blood from the leg into the abdominal cavity. So they tend to have a femoral hernia, but the treatment of that is very similar to an inguinal hernia, and again can all be done laparoscopically. So there's less pain, there's a faster recovery, a quicker return to work and to sport and the gym. Umbilical hernias are also very common, and they should also be fixed. It's usually a bulge in the belly button or just above or below the belly button, and they have a nasty habit of trapping bits of abdominal contents within them. So you can have a hernia repair if you were very frail and you had a lot of medical comorbidities. It would be possible to do them under local anaesthetic or sometimes under an epidural or a spinal anaesthetic. Usually, if you're young enough and fit enough, then they would be under general anaesthetic. And then the umbilical hernia is usually a small incision over the hernia, and that's repaired. If the defect's more than 2 centimetres, you put a bit of surgical mesh in to reinforce the defect. If it's less than 2 centimetres, you put some sutures in to correct the defect. For the groin hernias, which encompass the inguinal hernias and the femoral hernias, they can be performed laparoscopically, keyhole minimal invasive surgery, or through open cuts in the groin. The advantages of the keyhole surgery, which I specialise in, are that it's less painful, it's a faster recovery, a faster return to work and a faster return to sport and the gym. Usually the patient goes to the general practitioner and they've noticed a bulge in one groin, which could be bilateral. Usually it's unilateral or asymmetrical. They notice one groin has more of a bulge than the other, and they notice discomfort in that area, particularly when they're doing heavy lifting or exertional things such as going to the gym or playing sport. Clinically, if it's very clearly evident that they have an inguinal hernia, I would discuss the options of conservative treatment or surgical repair, and if I'm sure of the diagnosis, we can proceed to surgical repair at that stage, which is usually within a few weeks. If the diagnosis isn't clear-cut, I don't want to put a patient through an unnecessary operation if they don't definitely have a hernia, so I would then send them for a CT scan or an MRI scan, which would be performed within a few days here. I'm sometimes referred patients with groin pain and the GP suspects there may be a hernia, and often there isn't a hernia, but there is a problem called referred pain, and a lot of patients that have arthritis in the hip or have problems related to the hip, the brain only recognises the pain signals from the groin. So even though their problem is due to the hip, they present with groin pain, and then when I do the scan, we would be able to see that actually it's the hip causing the problem on the scan. So it's much better to identify the problem early, be referred to a surgeon, and then get the hernia fixed as a planned procedure before it causes problems such as incarceration, which means getting abdominal contents trapped in the hernia, which is very painful. It's probably the most common general surgery operation that we perform. I've had it performed on myself, so I've had keyhole surgery to both my inguinal hernias, which were caused by going to the gym, really. So now I feel I'm able to offer a perspective for the patient, both as a surgeon and And as a patient, I was back playing sport within 7 days. So I was very pleased with the outcome, and that's the outcome that I'm looking to offer for my patients.